afternoon. I'm Serena Collado, Director of Community Health at Robert Wood Johnson University Hospital, Somerset. Thank you for joining us today for our webinar, Organ Donation, presented in collaboration with Friends Health Connection. April is National Organ Donation Month, and today we are marking National Blue and Green Day to promote awareness of organ donation. Right now, there are nearly 4,000 people in New Jersey waiting for a life-saving transplant. These are our neighbors, colleagues, family, and friends. In our hometown here in Somerville, there are 10 people on the transplant list, 15 people in nearby Hillsborough, and 7 in Bridgewater. Thousands of transplants are made possible each year by living and deceased donors, helping patients with life-threatening diseases get a new lease on life. On today's show, we will learn more about the organ donation process, the need for organ donors, and how to become an organ donor. We are pleased to have with us Brooke Karim, Manager of Hospital Service for the New Jersey Sharing Network, a federally designated organ procurement organization in central and northern New Jersey. We are also joined by Deanna Pinsky, a registered nurse who is the Director of Critical Care at Robert Wood Johnson University Hospital, Somerset. Thank you both for joining us and welcome. Just as a friendly reminder, today's webinar will be 20 minutes of moderated conversation, followed by 10 minutes from questions and answers from our audience. For our audience, if you do wish to ask a question, please click on the chat feature and you will be given a box to input your questions that will come directly to us. So let's get started. Why don't we start with first, I'd like you each to share a little bit about yourselves and your role in organ donations. So ladies first, Brooke, why don't we start with you?
Sure. So thank you for having us, Serena. So my name is Brooke Karim. I'm here on behalf of New Jersey Sharing Network. I am the fortunate liaison to Robert Wood Johnson Somerset. I've been in this role for about 6 months now, but I've been with New Jersey Sharing Network for about 5 years. And I actually got involved with the organization because my dad gave the gift of a kidney transplant to my mom. So I was very much interested in the process. And I've done every role from administrative assistant to community education. And now I'm working directly with the hospitals and I'm working directly with donor families to guide them through that very difficult process.
Very nice. David, how about you?
My name is Deanna Pinsky. I'm the nursing director for critical care. I've been a nurse for 20 years. I think when I was a director in actually Newark, New Jersey at St. Michael's Medical Center, I actually became very familiar with the New Jersey Sharing Network. And then basically my role as a director is really helping to support the families and also to support our nursing staff taking care of our patients in this great time of need and being able to help assist along the way of giving a gift of life.
Wonderful. That's great. So speaking of patients, we start talking about patients who are in need of an organ transplant. So what are some of the statistics? Brooks, maybe you can share a little bit on that?
Sure. So you mentioned earlier there are about 4,000 people currently waiting for a transplant right here in New Jersey. We have about 115,000 people waiting across the country. When you look at the breakdown of New Jersey residents waiting, about 80% of those 4,000 are waiting for a kidney transplant. So the numbers are really staggering. New Jersey Sharing Network works solely with deceased donors. However, we do promote and educate on living donation, which is a huge part of the kidney transplantation process. But it is numbers that advocacy and education are really going to do quite a bit for in terms of making sure people understand this process of donation. It's really not something people tend to talk about, as we've seen at the hospital and across the state.
So what are some medical conditions that could lead to the need for a transplant?
Yeah, so that's also really kind of all across the board as well. We tend to think that people who need transplants are older and much sicker, but donation really doesn't discriminate. And I've met people who are pediatric patients all the way up to those in their 80s who are waiting for a transplant. And I'm sure David can speak to some of the diagnoses that go along with that, but it really does kind of cover an entire gamut of things.
David, did you want to add to that?
No, I mean, I think we see again, there's just vast ranges of different types of transplants that people are looking for and people that are waiting on lists for transports. I mean, in my career, I've seen lung transplants, we've seen kidney transplants, we've seen heart transplants, and it really varies across the continuum.
Wow. All right, so then how does one become an organ donor?
Yeah, so there are a lot of incredible ways to register to become an organ and tissue donor in our state and across the country. Actually, we have a new platform that people can utilize if you have an iPhone and go right into the mobile health app. You can now register to be an organ donor right there. And it is a legally binding document the same way as if you were to have it on your driver's license. So that tends to be what people are most familiar with. Everyone knows when you turn 18, you go to the DMV and you can register to be an organ donor. But now we have this online platform. You can go to registerme.org if you want to register. I'm sure with many people here, I don't enjoy going to motor vehicle on a Saturday, but it's very easy for me to go on my phone and register, and it only takes about 60 seconds now. And it's the same thing as having it on the driver's license and registering in that way.
Wow. Are there age limits to becoming an organ donor?
That's a great question. So to register to be an organ donor, we say that you need to be 18 years old to be a legally registered donor. However, with the new online registry now, those from the ages of 14 to the day before their 18th birthday can register their wishes or their intent, which is a huge step in the right direction because we are out in the high schools educating about donation in driver's ed classes, and to know that those students have the ability to go home and talk to a family member about this makes all the difference. In terms of what's the best bet to register or to talk about donation, we really just say having a conversation with your family makes all the difference. And we've seen that here at Somerset when we have families who mention donation to us before New Jersey Sharing Network's even involved. They bring it up to the staff and to the nurses and say, we know what our loved one would want. And that's the best possible outcome of donation, is that you've already had those conversations and you're not having them in that difficult situation in a hospital room.
Very interesting. So is organ donation supported by major religions?
Yeah, that's a really good question. That's something we hear at the hospital level quite a bit as well. All major religions support donation in one way or another. Most of them see it as the most charitable act that someone can give. But with that being said, we always say it's up to the individual's decision, and we encourage people to reach out to their local faith leaders and their family about that decision-making process. But everyone is willing to educate themselves about it, and we encourage people. We have a whole faith section on our website at njsharingnetwork.org to really learn about what your faith viewpoints on donation are so that you can understand it.
And I think it's important because from a religious consideration, it's also a spiritual consideration that really the families, you're going through a really difficult time, and it enables them to really have that moment with somebody, to really be able to share someone's life and be able to, along the continuum.
Wow. So, in addition to organs, tissues can also be donated. So one tissue donation can help around 75 people or more. So can you tell us about how the tissue donation process works?
Sure. So tissue donation we see as something that's not talked about as commonly as organ donation. We always talk about organ donation as a life-saving gift, but tissue donation is an incredible thing. And it goes on to help 75 or more lives, as you mentioned, but it can be upwards of hundreds of people that are enhanced from one tissue donor. So that's the gift of corneas, or giving someone the ability to see again. Bone grafting can go to help people who have been severe accidents. And then skin donation is really there to impact people's lives who've had breast mastectomy reconstruction or cleft palate repairs, burn victims, absolutely. So it really is an incredible thing, and it's one of those things that we encourage families to talk about just as equally as organ donation, because it is vastly important. And the hospitals tend to see tissue donation happen more frequently, so it's really important to discuss.
Good. So David, what is the hospital's role in organ and tissue donation?
I think our hospital here has a great relationship with the Sharing Network. I think that our role is really it's a collaborative role, it's a supportive role, it's a spiritual role. I think there's so many things that we do once we know that someone is going to be it's making sure that all the tests and procedures and all the pathways are followed to make sure that we're able to, have a special gift from this person. But also, it's really supportive to the families, because the families are here, and this is what almost like they're leaving a legacy of their loved one. And we really want to make sure that entire experience, and we're with them from start to finish along the way, working with the sharing network, coordinating with them, and talking about all the steps along the way. I think everyone from, from a housekeeper all the way up to senior leadership in the institution are all part of that, along with all the people within the sharing network, with all the physicians. And I think we really, we develop a bond with these families. Until up until the organ donation to the flag raising ceremony, there is, even if it's a couple of days, there's a huge bond that the hospital forms with the families themselves. And we really think that's one of our keys here, that how we embrace the families, we make them feel that this whole process is really, it's a celebration of their life, of their loved one's life.
And I think the thing to bounce off of David too, and he's very modest with his team, because we can't do this job without the hospital staff and without the Somerset staff in particular. They really go above and beyond for the families here. And, you can imagine a family who's lost a loved one. You would think the last thing they're thinking about is thanking hospital staff. But every time I've had experience here at Somerset, they come up to me and they say, the hospital staff has been so amazing. The nursing staff has been so wonderful. We're so grateful for how you took care of our family members. And that makes all the difference for them, because they will leave this hospital with a positive memory, not the fact that they lost their loved one here, but the fact that they were so well cared for, which really makes all the difference.
So the majority of families have thought about organ donation before or have not? Actually, how many organ and tissue transplants or donors have we had at the hospital over the past year?
So over the past year, we've had 2 organ donors, and we've also had 7 organs that were transplanted. We've had 17 tissue donors, and from those 17 tissue donors, we've had 940 gifts from the tissue donors. I think that, most of the families that come in here, it's right away. They automatically know. They know that this is what the person would do. And, it's what I find just from my experience, when it's someone that is younger, it's also an opportunity to celebrate that person's life, to, whatever circumstances brought them here to the hospital. It's really an opportunity for that family to kind of bond together and to really celebrate their life and to really make a positive out of a very difficult time.
Oh, thank you. So how does Robert Wood Johnson University Hospital Somerset actually promote organ donor awareness? So like today, National Blue and Green Day, what are some of the activities that we're doing?
So we actually had a ceremony at our Tree of Life today, which actually there's a ceremony for we actually had given daisies and sunflowers to all the staff. We had taken pictures there. We had said a prayer in front of that just to promote the awareness of organ donation. We're also giving we have cake and ice cream. We have I keep messing up the cake, but it's blueberry ice cream, and I keep saying pistachio, but it's actually not a chocolate mint chip.
But pistachio is also just as good.
It's just as good. I think the staff are very well educated. We also have in-services with the nursing staff very frequently on the units with the sharing network. So our staff are very well educated on having conversations about awareness and making sure that families are aware of that.
Very good. So these are the activities we were doing today. So how have we in the past actually honored some of the organ donors?
So we do have our flag raising ceremony, and we do have 2 years ago the Tree of Life was put up in the intensive care unit on the wall. The Tree of Life was actually created with, on the outside, are butterflies, and those represent organ donors. And there are green leaves with the names of tissue donors on the tree. So we've actually, we have the ceremony coming up this coming October, and we invite, if there are new donors, we'll invite them back. Or I'm sure there are probably older donors that we're going to invite back as well. And it's an opportunity they can see their family members, their loved ones there. And I know that for me, it was an emotional experience the first year that we did this, because you could see that, they're leaving something behind. They're leaving a legacy behind that's something that they can share with another gift with someone else.
Oh, very nice. Okay, so at this time, I'd like to open it up for questions from our audience. And again, audience, you can go onto the chat feature and you can type in your question from there. And why we're doing that, or why we're giving them an opportunity to do that, I want to just go back a little bit and just talk a little bit more about what are some of the disqualifiers of being an organ donor. Is there any scenario, condition, chronic disease somebody may have which would not allow them to become an organ donor?
Yeah, that's a really good question. And we get that from the community all the time when we do public education. I can't tell you how many times people have said to me, oh, you don't want these old kidneys, or my eyes are too bad. I would never be able to give someone the gift of sight. And that couldn't be further from the truth. We always tell people if you want to be an organ or tissue donor, you should register yourself and you shouldn't take yourself off the list. You shouldn't disqualify yourself. That's what our medical team from the hospital and from the sharing network is there to do, is to ensure that that organ and tissue is healthy enough for transplant. But medically, we are getting so much better at doing these transplants and these donations that we're doing transplants from people who are much older, people who are much sicker, and there really is no hard and fast rule out for organ and tissue donation anymore, the way there used to be maybe 10 years ago. So when we do education for the staff, we always say, you should make that referral call regardless of age or diagnosis, because we just never know. What I could tell someone today as a rule out may not be the same thing tomorrow, which is an incredible part of working in the medical community, is that we're just getting so much better at organ and tissue donation.
Oh, wow. So, okay, so looking here, so if somebody is hospitalized, but they haven't put anything or left anything on a living will or on their license saying they want to be an organ donor, can the family, if they know that that person will cease, say, we would like our loved one to be able to donate that. So in other words, if somebody hasn't indicated they want to be a donor now, can they, even at a critical point, and somebody else in the family say that, yes, we would like our loved one's organs to be donated?
Yeah, that's a really good question. So part of the hospital's responsibility and David's team's responsibility is to refer every patient that's meeting certain clinical triggers. And then the sharing network will look up to see if that's a registered particular donor or not. If they're not a registered donor, that doesn't mean we wouldn't approach the family. So our job is to offer the opportunity of donation to everyone who is medically suitable. So if that patient hasn't registered themselves as an organ donor, we would still work with David's team and we would approach the family for consent of donation. And at that point, if their loved one did not register, they would be the ones making that final and legal decision for them. So it's typically a legal next of kin that we would be asking.
Okay. So you mentioned clinical triggers. What are these clinical triggers that identify somebody as being a potential organ donor, or having that, or facilitating that conversation for organ donation?
Sure. Do you want me to put you on the spot? Yeah,
I have a trigger card actually right here. So we actually do give all the staff this trigger card here. So for organ donor referral, so they're intubated patients with any of these three triggers.
David, can you speak up just a little bit?
Okay, so all the nurses have this card, and actually talks about with any of these three triggers, like you just said, this is how we would notify the sharing network for a referral. So I can't read that. Is that too small? Actually, this is the first time I've heard it, so I can't even read it. So a Glasgow coma scale of 5 or less. That's an assessment that the nurses do, basically in terms of a neurological assessment that the nurses will do. Prior to extubation, beginning a discussion, withdrawal of life. So again, if we're taking based upon the score or loss of 2 or more cranial nerve reflexes, we test reflexes, and if we test these reflexes, and based upon that and the neurological assessment, we can then talk to the sharing network. So those are just they're just small little triggers, but they're an assessment that the nurses do for the patients when they come in.
Oh, very good. See, you got it.
I had to use my cheat sheet, but it was okay.
That's why it's there.
Well, it's good to know, and that shows how we communicate those, those important, protocols among the hospital nurses and staff, so that at any point when somebody comes into a facility, right, like ours, that they know that those processes are in place. So thank you for bringing up your cheat sheet. We appreciate
There you
that.
go.
So tell me, what is the most, I guess, popular donation? What do you see as what is being mostly frequently donated, or the most common donation?
Yeah, so if you take tissue off the table, because tissue donation happens about 10% of time of every single death that we see in the state, and organ donation happens about 0.1% of the time, so it's an incredibly rare gift for people to be able to give. So looking at tissue donation, kidneys are typically the most widely transplanted and recovered, and that really comes down to the fact that they're one of the most durable organs that we have. But when we talk about, pancreas transplants, intestinal transplants, those are very difficult to work towards recovery on. But kidney, liver, heart, those are typically our most commonly recovered things, which is, when we talked about that 80% of people waiting for a kidney transplant, it's a good thing that we're typically recovering that with every average case that we have. But that being said, organ donation is just such a rare gift to be able to give. I know when I turned 18, I just assumed one day I would become an organ donor. And this job has quickly made me realize that, it's a very special thing to be able to leave a legacy, as David had said. Not many people have the opportunity to do that. So when we talk to families, we really do talk about that your loved one was here for a reason, and they have this ability to leave this gift. And when we talk about people losing loved ones, the biggest fear anyone has is that their loved one's name will be forgotten. And when we talk about the tree of life, having those names up there for families to come in and see, and we put names up in the Sharing Network headquarters, and we have our 5K celebration of life. There are just so many ways to remember and honor that person, which really makes all the difference for the families.
Well, and you can write a little bit of a legacy with a donation, right? Because a little part of their loved one actually lives in somebody else, and they are, in essence, carrying on. Right. So that's very good that you do all those events and ways to honor the donors. So this one is about a pediatric donation. So let's say you had mentioned the age limits of somebody wishing to be, but let's say, unfortunately, and this may happen, let's start off with something basic before I ask this question. How many pediatric donations are done in the state of New Jersey?
So I don't have those exact numbers for you. I will say, because there is not an age limit on donation, pediatric cases do happen. We typically tend to see them at major trauma centers where pediatric intensive care units are. One of the things to note, even though there is no discrimination in regards to age, we do have to take into account patient size. So if you think about a pediatric patient, it's very likely that that organ is going to be transplanted into another pediatric patient. When I always say, I give the example of, if I were to pass away, I can't give my heart to an infant, just won't fit inside of that baby's chest cavity. So we see typically pediatric patients are given to another pediatric patient. In some cases, you can have a very petite adult, typically a petite woman, and they will recover potentially both kidneys to be transplanted into that one person. So it's an incredible experience that we've seen for pediatric families who have given that gift, and to know that there's another child or baby who's waking up the next day with a brand new lease on life, which, I can't even imagine putting myself in that position.
So this question, should a parent find themselves in that position and they have a child who they want to become a donor, what are the steps that parent should take? Is it the same process, or is it slightly different because they're under the age requirements?
Yeah, so in that case, we would still approach the family in the same way we would approach any family. Some of the questions are different. We have a very intensive medical social questionnaire that we would go through, that some of those questions wouldn't be required for someone under the age of 12. But it is the same process. And I will say, working in community education prior to moving into the hospital role, that this particular generation of students and of children and of teenagers, they are very actively excited about making a positive change in the world. And when we talk about organ and tissue donation with them, the typical reaction is, well, why would I not do that? Which is the reaction you hope that everyone has. But they don't only want to see a change in the world, they want to be a part of that change. So when we do education for high school students, the common theme is, well, this just seems like a no-brainer. Of course, I'm going to register to be an organ donor. But that's something that not everyone feels the same about. And it's incredible to see this young group of students who's going to go on to impact the world of donation, not just in registering, but in the fields that they choose to work in and going into the hospitals and the research. And they are really going to be the forefront of what changes, the medical field and transplantation and things like that.
Wow, thank you. Now the last question is regarding acceptance of donations. So could you briefly describe what is the process to ensure that something that is going to be donated will be accepted by the recipient?
So that's a complicated question. And taking off my sharing network hat for a second and putting on a recipient family hat, I can say that it's a very lengthy process to get waitlisted for a transplant in the first place. You're working through, a local transplant center like Robert Wood Johnson in New Brunswick, who does kidney transplants. It's, they need to make sure you're healthy enough to receive that transplant and to survive that transplant. So afterwards, New Jersey has a very good track record, and it really comes down to the surgeons that work in our transplant centers for recovery after a surgery. But it's a lot of it comes down to compliance, and we see this with any particular patient in a medical unit. Making sure that you're taking care of yourself and taking care of that new gift that you've received, taking those medications. As we know, transplant recipients have to take a lot of different medication, but all that being said and done, it really is very much on the recipient to ensure the health of that organ, doing those follow-up visits. And every recipient I've ever spoken to has told me, I would never do anything to jeopardize this gift that someone gave me, because I'm here today and that person is not here today. And they take it very seriously, that honor that they've been given.
Very good. So is there any clinical matches, DNA testing or anything like that on the clinical side? David, did you want to?
I think there is, there's sort of typing and blood typing and all different types, so there's correct batches for the different organs. And again, it's definitely a lengthy process. And obviously, I think the biggest component of it is the recipient, how they manage their life, and the way that they handle their life afterwards. Because again, there are patients that can reject certain things, but for the most part, it's really following the protocols, following the medications, doing the appropriate follow-up. It's a big procedure, but then it's the other part of any other chance of life. And I think all the recipients that I've met have just been so gracious and so that they've been given this extra chance of life. But I think they have to you really have to have a full understanding of what the gift you're getting and what's your obligation, because you have an obligation to the person that's giving you a gift, making sure that you do all the things that you need to do.
Yeah, I will say most recipients I talk to, they say, I'm not living my life just for myself anymore. I'm living it for this heart recipient. I received this heart transplant and I need to live the life for two of us because the other person isn't here anymore. It's such a powerful thing to meet a recipient and hear how much they care and how grateful they are, because there is a lot of recipient guilt that comes with receiving a transplant from a deceased donor and knowing that you are alive and here today and that family has lost a loved one. So there's a lot that plays into what the recipient feels when they wake up from that surgery. I've had a lot of conversations about that. But on the back end, prior to, and the sharing network staff is typically overnight at a hospital for 24 hours to do a lot of that cross-matching, as David had said, and tissue typing. And, the main thing is making sure that that organ is going to be successful in that patient.
Wow. Any final words or anything you wish to convey to individuals about organ donation?
Yeah.
Sure.
Ladies first.
Thank you. So I would just say, more than anything, it is so incredibly important to have a conversation about donation. We really shouldn't be having a conversation for the first time in a hospital room. And I can't express enough, working here and being a recipient family and just knowing how important this is and how rare that it is to have those conversations and to educate yourself. I can't express enough going on the Sharing Network website, njsharingnetwork.org, to look that information up and educate yourself and have that conversation. It doesn't really need to be a scary conversation. We're just talking about the life that someone has the ability to leave and the wishes that you would want to be met.
I think for me, it's, I'm the fortunate one because I get to be there, obviously the most time of need of families, but we also get to share something with them, a really special moment. And I think that, we take this very seriously. And, just, I'm not using any names or anything, but I can talk about our last donor experience here in the hospital. Just really left a big impact on myself and also my staff because they really connect with the families. They really from start to finish. And, it was a celebration of that person's life. This is not, and that's how we look at it. We look at it as we are celebrating their life and, what they can leave behind. So that's a very, very special thing.
Wow, that's great information today. So thank you both for joining us. This concludes today's webinar. Please remember that the opinions shared here today by our medical experts are not a substitute for medical advice from your physician. If you need a physician, please call 1-888-724-7123. For more information about Robert Wood Johnson University Hospital Somerset, please log on to www.rwjbh.org/Somerset. For more information on becoming an organ donor, please visit www.savenjlives.com. Thank you all and have a great day.